Hello and welcome to the lecture series by PALi. In this presentation, we'll be focusing on the abdominal aortic aneurysms. So first of all, an aneurysm is an abnormal dilatation of a vessel by more than 50% of its original diameter. And true aneurysms involve all layers of the vessel. For the abdominal aorta to be considered aneurysmal, it must be more than 3 centimeters inside. And so this is the criteria for which we use to diagnose them. The development of AAA begins with the degradation of the vessel's elastin fibers and also the smooth muscle fibers. There are many contributing factors that lead to damage of the aorta that leads to this degradation. Some of these include infection, inflammation, and trauma. But all of these factors lead to progressive dilatation of the vessel, and so the aneurysm grows. This picture here just shows the position of a AAA. So typically it rises underneath the level of the renal arteries and above the bifurcation of the aorta into the iliac arteries. Some risk factors for AAA are older age and also being a male. These factors are very important, and so there are screening programs for males aged 65 to have ultrasound to identify any asymptomatic aneurysms. Other risk factors include smoking, hypertension, cardiovascular disease, and connective tissue disorders such as Marfan's or Ehlers-Danlos, and a positive family history of a first-degree relative having a AAA. Signs and symptoms of a AAA can vary, and so a patient may be asymptomatic with the aneurysm being diagnosed as an incidental finding after being investigated for another condition. Patients may feel a mass in the abdomen or be complaining of bloating feeling. They may have pain which radiates to the back from their abdomen, and patients can sometimes present with collapse as their first presentation, and this may be due to a rupture of the aneurysm. Patients can also be found dead, and this may well be the first presentation of the aneurysm after a rupture. Signs of a AAA include an abdominal mass that is both expanding and pulsatile in the abdomen, in the midline, and there may also be a bruit when auscultating. If an abdominal aneurysm is suspected, then imaging is the most appropriate investigation, with ultrasound being the first line investigation. And this can be used to identify the size and location of the aneurysm and can identify any thrombus that may be present in the aorta. The next step would be to perform a CT angiography of the aorta, and this method gives a full picture of the abdominal aorta and can identify involvement of any other important arteries such as the renal arteries. This method can be used to map the aneurysm and identify its suitability for repair, and can also be used to customize the type of grafts that are used to repair the aneurysm. Complications of a AAA include a rupture, the presence of a thrombus in the vessel, which can be a source of emboli, which can cause downstream problems in the lower limbs. Fistula formation is also a complication to nearby structures like bowel or bladder, and this can lead to bleeding into these organs. And because of these complications with aneurysms, it's important to identify those in the community through screening programs, as mentioned earlier on, and to monitor those that are already known. So if an aneurysm is detected and it is between 3 and 5.5 centimeters, then it is monitored annually, unless it is symptomatic or is expanding at a rate of greater than 1 centimeter per year. Along with monitoring, there's risk factor modification, including smoking cessation and control of high blood pressure. And if an aneurysm becomes greater than 5.5 centimeters, then the risk of rupture becomes around 25%, and this is an indication for elective repair. There are two different methods for repairing AAA, and this can either be via endovascular aneurysmal repair, or EVAR, or it can be through an open abdominal aortic aneurysm repair. EVAR is an interventional radiology procedure where catheters are inserted into the femoral arteries and moved up to the level of the aneurysm and used to deploy an endovascular graft to the aneurysm. This method is typically used for patients who are not fit for a full anesthetic, and these are typically used for older patients. An open repair is a much larger procedure and is much more complicated, but it has better results and actually lasts longer than the endovascular treatment. It involves a large midline incision to regain access to the aorta. The aorta is clamped, and that aneurysmal sac is dissected open, and an artificial graft is placed inside, and the aneurysmal sac is then stitched back over the graft. Complications of repair include dislodging thrombus from the aneurysm, and this can lead to downstream problems such as trash foot, where the small vessels of the foot become blocked, or larger vessels further up the leg becoming blocked, leading to acute limb ischemia. Precautions are taken to anticoagulate patients. The graft can be occluded, and this again can lead to acute limb ischemia. Infection is another problem due to the implanting of artificial material in the body, and so infection can occur. And the graft may leak or slip from its position, and this can cause blood to escape from around the graft into the aneurysmal sac and can lead to either rupture or further dilatation of the aneurysm. The major complication of a AAA is a rupture, and it is important to identify this as it is a surgical emergency. And so symptoms of a AAA rupture are a sudden intense abdominal pain, typically radiating through the back or down into the loin or groin. Sudden collapse is also a symptom, and this is owing to the large drop in blood pressure due to the rupture of the aneurysm. Some signs of a rupture will be a very hypotensive patient. They'll be very peripherally shut down and sweaty and clammy. They'll have weak peripheral pulses and may have acute ischemic legs, or so-called blue toe syndrome, where there is no blood getting to the peripheral limbs. As I said, AAA rupture is a surgical emergency, and it has a high mortality rate at the time of rupture of 50%. Of those patients who reach hospital and are treated, around 40% still unfortunately die, and so it is very important to recognize the signs and symptoms and to treat the patient with a ABC approach, attempt to resuscitate the patient at the same time as calling the vascular surgeons and the theatres to prepare the patient for emergency repair. In summary, a AAA is an important diagnosis to make in older male patients, especially those who present with abdominal pain radiating through to the back. There are screening programs for all men at 65 years old, and this is to have an ultrasound scan to identify any asymptomatic aneurysms. A AAA can be treated either endovascularly or via open repair, and a rupture of a AAA is a surgical emergency and has a high mortality rate associated with it. And it is very important to act quickly, adequately resuscitate the patient, and also contact the vascular surgeons